Well, hello there. This is Professor White, and today we're going to talk about those medications which help control the acid in the stomach. As we get started here today, we're going to talk about the different secretions that the stomach has and where they come from and sort of what they do. And I'll be going back and forth sort of between this slide, the pathophysiology, as well as the cells of the gastric gland. So again, this is just overview. So, let's talk first about what the stomach secretes. The first thing is hydrochloric acid. So, hydrochloric acid creates an acidic environment in the stomach, which will allow pepsinogen be activated into pepsin, and pepsin is what breaks down proteins. The hydrochloric acid also helps break down food and kills bacteria and pathogens that are ingested with food. Bicarb or bicarbonate neutralizes stomach acid, protecting the stomach from erosion, and it maintains that pH balance. Pepsinogen is the inactive enzyme that, when it is activated by hydrochloric acid, becomes pepsin, which we already said breaks down proteins into smaller peptides. Intrinsic factor is essential for the absorption of vitamin B12 in the intestine, in the small intestine, and without it, a person can get B12 deficiency. This would be one of the megaloblastic anemias. Mucus is a protective barrier. It coats the stomach lining to prevent the stomach acid from damaging the tissue. And then prostaglandins. So prostaglandins have several roles, including stimulating the secretion of mucus and bicarb, regulating blood flow to the stomach lining and ensuring that it remains healthy and protected. And basically, all of these things work together to facilitate digestion and to protect the stomach. We will delve into hydrochloric acid just a little bit more here because of its importance. So the stomach pH is maintained at 1 to 4. This is way, way acidic when you consider what the normal cells of the bodies are, which is 7.35 to 7.45. And because of that acidity, we spoke briefly, but it allows for proper digestion of the food and protects us against many bacteria that are out there. So the parietal cells do secrete hydrochloric acid, and lots of things can cause it. So one of them is neural regulation, so like the vagus nerve stimulation. So when a person sees, tastes, or even thinks about food, the vagus nerve is stimulated, and that, by way of acetylcholine, ends up stimulating the parietal cells in the stomach to produce hydrochloric acid. There's hormonal regulation by way of gastrin and histamine. So histamine binds to the H2 receptors on parietal cells, which enhances hydrochloric acid production. And you should be thinking to yourself, wait, I'm starting to figure out that some of the medications that we'll use for the stomach are going to interrupt some of these processes here. Chemical regulation. So food presence, especially proteins, can directly stimulate acid production by increasing gastrin levels. And calcium and alcohol stimulate the stomach lining to secrete more acid. And then stress, anxiety, and emotions can influence vagal stimulation and consequently that hydrochloric acid secretion. Stress often leads to increased acid production. And there are some feedback mechanisms like somatostatin. So that hormone inhibits hydrochloric acid secretion, and when the pH becomes too low, it's like a negative feedback mechanism to regulate the acid levels. And then medications can also affect the hydrochloric acid secretion. So medications like antacids, H2 blockers, proton pump inhibitors, which we will talk about. All right, so peptic ulcers are sores that develop in the lining of the stomach, lower esophagus, or even small intestine that's due to the breakdown of that protective mucosal layer. So the main types are the gastric ulcer, which is found in the lining of the stomach, often causes pain shortly after eating as the food stimulates the acid production. Duodenal ulcers, which occur in the first part of the small intestine, or the duodenum, and the symptoms of that, basically pain typically occurs several hours after eating and may be relieved by eating again or taking antacids. Esophageal ulcers are located in the lower esophagus, and the symptoms of those are what we normally think of with GERD or gastroesophageal reflux disease, and can cause pain, especially when swallowing. Peptic ulcers can be caused by a lot of different factors. Stress, excessive alcohol consumption, smoking, certain medical conditions can also, sort of predispose a person to ulcer formation. But some of the big things are NSAID use, so regular use of NSAIDs such as aspirin and ibuprofen, and Helicobacter pylori infection, which we'll talk about on the next slide, but that's a common bacterial infection that can damage the protective lining of the stomach. Some complications of peptic ulcers would include bleeding, which can lead to significant blood loss and anemia, a perforation, which is a hole in the stomach or the intestinal lining, which can lead to severe infection, and obstruction due to swelling and scarring that can block the passage of food. While we're on the concept of H. pylori, so treating an H. pylori infection typically involves a combination of antibiotics and acid-suppressing medications, usually triple therapy or quadruple therapy, meaning that triple therapy is 2 antibiotics with a proton pump inhibitor, medications like omeprazole, lansoprazole, to sort of reduce the stomach acid and enhance the antibiotic effectiveness, or quadruple therapy, which is 2 antibiotics, typically metronidazole and tetracycline, Pepto-Bismol or bismuth suddenly I can't speak this morning, but basically Pepto-Bismol, and a proton pump inhibitor. It's important that a person have follow-up testing to ensure the infection has been eradicated. A follow-up test, usually a breath test or a stool test, is recommended about 4 weeks after completing therapy. Of note, H. pylori is found in 90% of patients with duodenal ulcers and 70% of those with gastric ulcers. There can also be stress-related mucosal damage, so GI lesions are a common finding in the ICU, especially within the first 24 hours after admission. And some factors that may predispose a person to a stress ulcer would be decreased blood flow, mucosal ischemia, hypoperfusion, or even reperfusion injury. Additionally, nasogastric tubes and ventilators predispose patients to GI bleeding. And this is why a histamine blocker recepting drug or a PPI are given for prevention of ulcers in the ICU. Although we still see it on the floors, data does not support the continued use of stress ulcer prophylaxis after the patient's no longer in ICU. However, many of our patients have predisposed gastric complications and issues and have GERD already, so you will still see those being given quite frequently. So when we begin to think about antacids, what they are basic compounds that are used to neutralize stomach acid. These can be things like aluminum, magnesium, calcium, and or sodium, as you can read there, and they may also contain the anti-flatulent medication simethicone. The reason that many of the formulations contain magnesium is because you have to think of what happens with aluminum and especially calcium. Calcium is known as a constipating medication, is a constipating drug, and because it really acts as a sedative in the body, right, in the muscles, and the GI tract is full of muscles. So by adding magnesium, it kind of helps counteract that constipating effect. So some of the bad about them are, of course, that things with a lot of calcium can cause kidney stones and increased gastric acid secretion. Magnesium cannot be used in patients with renal failure. And sodium bicarb, when it's used, it's a very quick onset, but it doesn't last very long either. So antacids don't actually prevent the overproduction of acid because that's controlled by other forces. However, it does neutralize those acid secretions and also stimulates secretion of mucus, which we know to be helpful and as a protective barrier, bicarb, which is a buffer against acidity, and then prostaglandins, because when prostaglandins are in play, they basically activate the proton pump. The effect of the antacid drugs really are on the pain perception of the patient. So if you see here, it says raising the gastric pH by only 1 point neutralizes 90% of the gastric acid. And that causes pain relief as a result of basically increasing the resistance of the stomach lining to irritation, increasing the tone of the cardiac sphincter. All right, so a person would use antacids because they are having symptoms related to either a duodenal ulcer, H. pylori, something of that nature. So contraindications, we already spoke about things. Anybody with renal failure, they have a problem with their electrolyte homeostasis related to the functioning of the kidney. So you must be very careful, and many of these preparations would be contraindicated for a patient with severe renal failure. And again, there's a potential for accumulation of these electrolytes to toxic levels. And antacids are contraindicated in GI obstruction because they can worsen the condition that lead to serious complications. There's the problem of like a risk for gastric rupture because antacids can cause the stomach to expand, which increases the risk of gastric rupture, especially in the presence of a known obstruction. Delayed gastric emptying, because antacids can slow down gastric emptying, which exacerbates the obstruction. Antacids can interfere with the absorption of other medications that might be necessary to treat the obstruction or its underlying cause. And then in cases of obstruction, there's a risk of aspiration if the stomach contents are not properly managed. And believe it or not, antacids can contribute to that risk. There are a bunch of antacids available, and many are over the counter. Things like capsules, tablets, powders, chewables, suspensions, and even effervescent granules. And they are used alone or in combination, and we'll kind of take a walk through them. Basically, aluminum, magnesium, calcium, and sodium bicarb. The aluminum salts will be the class of medications that you may be familiar with over the counter: Gaviscon, Maalox, Mylanta. Basically, things to know about the aluminum salts are here, but I'll highlight the fact that they are more often recommended for people with renal disease because it's more easily excreted, the aluminum is. So for nursing, we'd want to monitor for constipation, which is a common side effect, and encourage adequate fluid intake and a fiber-rich diet. Make sure you're assessing kidney function, especially in patients with renal impairment, because aluminum can accumulate in the body. And there's also some interactions, such as decreased absorption of tetracyclines, fluoroquinolones, and iron supplements. All right, let's go on to magnesium. Magnesium antacids such as magnesium hydroxide, which is often known as milk of magnesia, is commonly used to neutralize stomach acid and prevent things like heartburn, nausea, and indigestion. So it is often used in combination with other antacids to increase their effectiveness. The diarrhea is a common side effect, so we want to encourage fluid intake to prevent dehydration. Magnesium can accumulate in the body and become very dangerous, so very cautious use for anybody with renal impairment, and often contraindicated. Also can cause decreased absorption of tetracyclines, fluoroquinolones, and iron. And again, want to monitor our patients' labs throughout because long-term use can lead to elevated magnesium levels, especially with renal failure. So calcium salt antacids, such as calcium carbonate, which is found in products like Tums and Rolaids, they're commonly used to provide relief and neutralize stomach acid. It's often used in combination with other antacids, available in tablets, capsules, and liquids. So constipation is a common side effect, so make sure we're encouraging adequate fluid intake and fiber-rich diet. We're going to assess for signs of elevated calcium levels in the body, and especially in patients with renal impairment or those taking calcium supplements. There are a lot of drug interactions, and is the same as we mentioned previously about the tetracyclines, fluoroquinolones, and iron supplements. And the calcium, because it can cause constipation, can actually lead to fecal impaction and intestinal obstruction. So sodium bicarb, which is considered a sodium bicarbonate antacid, is often found in products like Alka-Seltzer. So Alka-Seltzer and these sodium bicarbs, they can cause fluid retention. So you're going to want to monitor your patient for fluid retention. Increased blood pressure related to the fluid retention. Again, the same interactions with the tetracyclines, fluoroquinolones, and iron. And remember, this fluid retention can lead to edema, increased blood pressure, metabolic alkalosis with long-term use. Can cause nausea, vomiting, and stomach cramps as well. Used very cautiously in patients with heart disease or high blood pressure or heart failure or renal impairment. So avoid prolonged use in those patients. So we've talked about some of the adverse effects, and this is just sort of a little bit of an overall slide. But again, metabolic alkalosis with overuse, constipation with aluminum and calcium, magnesium causes diarrhea. Calcium can cause a buildup of renal stones, and calcium carbonate causes gas and belching. All right, so the chelation effect on certain medications can occur, which means they can form insoluble complexes. And this is particularly important for medications that contain metal ions. So the tetracyclines, so antacids, can significantly reduce the absorption of tetracyclines, such as doxycycline and minocycline. And similar to the tetracyclines, antacids can decrease the absorption of fluoroquinolones, like ciprofloxacin. They can also reduce the absorption of levothyroxine. And antacids can decrease the absorption of iron supplements, which reduces their effectiveness. So to avoid these interactions, it's recommended to take antacids at least 2 hours before or 4 hours after other medications. Okay, so let's go into some of our treatments here with our histamine 2 or H2 receptor antagonist. So basically these H2 blockers, as they're called, work to reduce the amount of acid produced by the cells in the lining of the stomach. They selectively block the H2 receptors in the parietal cells of the stomach lining. And remember that histamine is a chemical that, when it binds to the receptor, stimulates the production of gastric acid. And by blocking those receptors, the H2 antagonists prevent histamine from stimulating acid production, and thereby reduces the volume and the concentration of the stomach acid. And with less acid being produced, the pH level in the stomach increases, so it becomes less acidic, which helps to alleviate the symptoms of conditions such as GERD and peptic ulcers. The common H2 antagonists are famotidine, cimetidine, and nitazidine, or Axid, or nizatidine. I always say that one wrong. We used to have ranitidine, but that was pulled off the market, so you don't see that anymore. All right, and you can certainly see here what we just talked about with the mechanism of action, and then of course the drug effect. Again, it's everything that we just talked about. All right, so as far as the adverse effects, there are very few adverse effects, but some common side effects would include headaches, dizziness, constipation, and diarrhea. Cimetidine can cause impotence and gynecomastia, which is enlargement of breast tissue, and famotidine can cause thrombocytopenia. So as we consider that, you would want to make sure you knew what the recommendations would be for monitoring, right? So you want to make sure that we look at those values which can tell us about thrombocytopenia, which would be like the CBC. Also, because H2 antagonists are metabolized in the liver and excreted into the kidneys, we'd want to monitor their function and inform patients about the correct timing and dosing, and advise against the consumption of alcohol, which can once again increase gastric acid production. Okay, as far as interactions, so all H2 blockers can inhibit absorption of drugs that require an acidic environment in the stomach. And that makes sense, right? Because it's decreasing the acidity. Smoking decreases the efficacy as well. And the cytochrome P450 enzymes. So to remind yourselves about these P450 enzymes, or CYP450, these enzymes help break down drugs and other substances in the liver. And when a drug enters your body, it binds to those enzymes. And those enzymes use oxygen to change the drug structure, which makes it easier for the body to get rid of it. And everybody's P450 enzymes work a bit differently, which is why some people process drugs faster or slower than others. Cimetidine is one of those that definitely interacts with that system, and this can lead to increased levels of drugs metabolized by those enzymes, potentially causing adverse effects and toxicity. All right, so here is the list of all the proton pump inhibitors. Some of these shall be very familiar to you as you go into your nursing career, especially pantoprazole and omeprazole and lansoprazole. I want to say those are the most common that are used in the inpatient setting that at least I see. Pantoprazole, especially because it's available in an IV form. We give it IV push for stress ulcer prevention, and we can give it in a continuous IV infusion if we're treating an active gastric bleed. So proton pump inhibitors are a class of medications that significantly reduce stomach acid production. They work by inhibiting the hydrogen potassium ATPase enzyme system, which is called the proton pump, in the gastric parietal cells. Now, that enzyme is responsible for secreting gastric acid into the stomach. So by blocking that enzyme, the PPIs effectively reduce the amount of acid that's produced, which helps in treating conditions like GERD and peptic ulcers, etc. And you can see here the list of everything that is treated with it. Feel free to pause, but definitely it's a fan favorite in the hospitals and in the outpatient arena. All right, so some adverse effects. So as we change the pH of the stomach, we have the potential for more intestinal infections, including Clostridium difficile, or C. diff. So osteoporosis is a potential with long-term use. We often advise patients to take a vitamin D and calcium supplement if they're on long-term PPI to help maintain their bone health. Pneumonia. So there are some findings that there's an increased risk of developing community-acquired pneumonia if the patient is taking proton pump inhibitors. So basically increases the risk up to 73% by some of the studies that I've seen. And although the mechanism is not fully understood, it's thought that reducing stomach acid may allow for overgrowth of that harmful bacteria in the stomach, which can then be aspirated into the lungs. Decreased magnesium. And that's because PPIs can inhibit the active transport of magnesium in the intestine, which reduces the absorption, usually if the patient's on them for longer than a year. There is a link between PPIs and dementia, believe it or not. So there was a study that was done with over 5,000 people in it that found that long-term PPI use had a higher incident of dementia, 33% higher on average. Now, this doesn't mean the PPI caused it, but there is definitely an association of it. And there's a type of lupus that is induced by PPI uses. I'd like you to pause on this slide and take a peek at all of the drug interactions for our PPIs and basically make sure you know then how important it is that we're doing medication histories on our patients and also assessing the necessity of long-term PPI use and considering alternative treatments and lifestyle modifications. Food may decrease the absorption of PPIs. This is why they're generally taken on an empty stomach before meals. So sucralfate is a gastroprotective agent that works by forming a viscous paste-like substance in the stomach, and that substance adheres to the ulcer sites, which creates that protective barrier. It binds to the ulcer and protects it from further damage by blocking the diffusion of acid, pepsin, and bile salts into it. And additionally, the sucralfate stimulates the production of gastric mucus and bicarbonate. which further helps protect the stomach lining. So as you can see here, there are some side effects: constipation, nausea, and dry mouth. It can impair absorption of the other drugs, so you want to space it out by about 2 hours. Don't give it with other medications. And then this binds with phosphate. So this is why sometimes you'll see this being given for patients with renal failure as a phosphate binder. But in general, it's used for stress ulcers and peptic ulcer disease. So misoprostol or Cytotec is a medication that's generally used to prevent NSAID-related gastric erosions, because if you were to give it in high enough doses to actually treat an ulcer, there are a lot of side effects and it's not well tolerated, so it's better as a prevention. So basically, NSAIDs cause ulcers because they inhibit the production of prostaglandins, which protect the stomach lining. So by replacing these prostaglandins, misoprostol helps maintain the integrity of the stomach lining and prevent ulcers. So the recommended dose for preventing ulcers is 200 micrograms 4 times daily with food. And if that dose isn't tolerated, the lower dose of 100 micrograms every 6 hours can be used. Again, misoprostol can cause side effects like diarrhea, abdominal pain, and nausea. As a reminder, misoprostol is not safe to use during pregnancy. It can cause serious effects like birth defects, premature birth, miscarriage, and uterine rupture. So if the patient is pregnant or may become pregnant, they should not take this medication. It's crucial to have a negative pregnancy test before starting the medication and to use effective birth control while taking it. So simethicone is an anti-flatulent drug. It sits here because it's used in combination with some of the antacids. Basically, it breaks gas bubbles into smaller bubbles and makes them easier to expel. So the patient has more symptomatic relief, but for those around them, we might notice more gas. All right, so let's go into the nursing implications. These are where all the money shots are, and we'll take a peek at that. So antacids, this is nursing care in general. So assess for any allergies or pre-existing conditions. Looking for things like fluid imbalance, heart failure, any GI issues, pregnancy, renal disease. Look at these medications as holding sodium potentially. So use that information for those patients with heart failure or hypertension. Remember, most medications should be administered 1 to 2 hours after an antacid. And antacids can cause the enteric-coated medications to dissolve sooner than we expected, and that can cause GI upset. Make sure the patient chews what are meant to be chewed and shake any liquids. At least 8 hours of water to enhance absorption, except for anything like we have lansoprazole orally disintegrating. That would be one that you would not want to do that. So just look at the form of the medication. Remember, our patients treat a lot of things at home, and long-term use of these medications without a provider's input and information can actually mask a problem that's underneath. Adverse effects depending on which drug the patient is taking. A lot of GI effects because these medications primarily work in the GI system. And then for calcium, look for constipation. Remember, our H2 antagonists assess for allergies and their liver and renal functioning because of what they can cause with the confusion and such. Be very careful in patients who are already confused. These meds should be taken 1 to 2 hours before antacids, and they can also be given IV. We often will give famotidine IV in the hospital. And proton pump inhibitors, remember to assess for any allergies and history of liver disease and renal impairment. If your patient is on diazepam or phenytoin or warfarin, make sure that you know that this can make them absorb differently. Pantoprazole capsules, when you open them up, they have little balls in them, and if you put them in too small of a bore feeding tube, whether it's an NG tube, G tube, J tube, J tubes notoriously get gummed up with these things. You should be very careful and hesitant because understand, unless that tube is big enough, it's going to clog it up. All right, and here is the last slide. Here's our cartoon. Yay, we made it. So it says we removed the red hots to cure the heartburn. We removed the milk duds to cure the lactose intolerance. We removed the butterscotch discs because, well, they're delicious. All right, you guys, thanks for hanging out with me. Feel free to like and subscribe if you like and would like to subscribe.